Welcome to Beauty and the Brain with your hosts, Dr. Chris Croley and nurse practitioner Jerry Drinkard. Get ready to dive into the latest in revolutionary treatments, cutting-edge devices, and wellness secrets. Whether you're a consumer or provider, we're here to empower you at the forefront of beauty and aesthetics.
Hi, everyone. Welcome to another episode of Beauty and the Brain, the podcast where we discuss all things aesthetics. I'm your co-host, Dr. Chris Croley.
And I'm family nurse practitioner Jerry Drinkard. And together, Chris and I own Skin and Tonic, med spa located in Pace, Florida. We're happy to have joining us today on the episode of Beauty and the Brain, Miss Allie Ballew, one of our favorite nurse practitioners because she is part of our Skin and Tonic family. So thank you for joining us.
Yeah.
So, Allie, you've picked this topic for today. We always love Allie topics.
I'm excited about this topic today. I think it's like a highly requested procedure, but not necessarily a procedure, a highly requested result that we get from all clients at the clinic, and it's brow lifts. So everybody comes in wanting a lifted brow, but they don't necessarily always know how to ask for it, and it's for us as providers to explain to them, you know, what the best options are, how many options there are out there, and what's going to be best for them to help achieve their results.
So, yeah, you're right, Allie. Not everyone always understands exactly what they want. It's up to us as aesthetic providers to help guide them through treatment options. And Jerry, we've been doing this for a long time, and you definitely know that early on, that was one of our most commonly requested procedures. What can you do? And people just pull, and they pull in various parts of their face. Brow is very common. Mid-face is the second most common. They pull and they want it elevated, but it's not always as easy as that appears.
And I also think oftentimes people don't really know exactly what they want, and they get confused between needing an upper bleph and...
What's an upper bleph?
So, I'm sorry, when I say upper bleph, I just mean removing excess skin from the upper eyelid. Lower blephs, removing skin from the lower eyelid. So, and our common complaint with a lot of female patients and some male patients is that their makeup is difficult to put on because of like excess skin on the eyelid. And so I think that, you know, people know what their problem is. They don't know exactly what to ask for to get a resolution. But there is a difference, and sometimes you can achieve the result they want without it absolutely giving them, you know, a brow lift.
So, Allie, kind of in your research for this, I know that you looked over some things, and I certainly have kind of my general understanding, but why don't you elaborate a little bit to our listeners about what are the underlying causes that may contribute to a heavy brow or excess tissue of the eyelids?
A lot of times it's going to be age, skin laxity. You can also get some of that brow heaviness is kind of how or a brow ptosis from neuromodulators like Botox or Disport or any of those neurotoxins. And so sometimes that's a result of your tox, but also it can just happen with age over time or a combination of the two.
So I know from my standpoint, it's something that I try to educate new aesthetic providers as they're coming into the space, because we all are very, very quick to pull out, Botox or Disport or any of the neurotoxins and freeze a muscle without thinking of the long-term implications of that. And as we don't use a muscle for a long period of time, that muscle shrinks, just like the muscles in our arms or chest. If we don't use them, they shrink. So if you look at, I think I'm a prime example of this, and I get comments all the time about how smooth my forehead is. And yes, I will agree that it's smooth. And I've had some sort of neurotoxin in there, Disport primarily, for at least 18 years now. So over a long, long period of time, the only muscle that can lift up my eyebrows and the upper part of my face is a muscle called the frontalis muscle. But I've kept that frozen for so many years to keep a wrinkle from being there. Now my brows are a little bit heavier, so they sit lower near my eyes. And there's nothing we can do with any kind of toxin to elevate or to raise that, because there's no muscle there to really treat anymore. It's very, very thin at this point. I would have to let that wear off. And I believe that's a hard concept for patients and for new providers to understand, because a lot of times they think when we put one of those toxins in their forehead, that's going to raise their brow. And they don't understand that actually it could be lowering it, because that's the only muscle we have to raise it.
I think it's a very common misconception with neurotoxin in general, and I think that we kind of do patients a disservice by not educating them about the long-term impacts that neurotoxin can have in the frontalis especially. because it's very easy to like perk a brow up or change the shape of a brow. And you can certainly open the eyes up and make it look much more refreshed by treating the 11 lines, the glabellar complex. But if you treat that in the outer part of the eyes, and it does give a much brighter, wider look. But if you continue to keep the frontalis, Chris and I have both like dealt with the brow heaviness, and I truly think it's because we've had tox for so long.
Yeah, and I wouldn't trade it. I mean, I'm glad I have no lines in my forehead. I like the way my skin looks. But also when I, talk to patients about this, I'm like, it is a trade-off. At some point, you're going to have to decide, like, this heaviness is just a natural trade-off that if I keep enough toxin in there, which then brings us to, let's finish up on the causes that will contribute to this, and then we'll get into some of the treatment options. So, neurotoxin use over a long period of time or muscle atrophy can be one. You mentioned skin laxity, and that, is from multifactorial as well. So that can be from environmental factors, photo damage, aging, so UV exposure where we lose elasticity, we lose elastin, we lose collagen, and that all causes that kind of to droop down. But there are some other things that can contribute to this as well.
Bell's palsy, like they're medical conditions that contribute to it. There can be physical injury to the muscle that can cause it. There are some aesthetic treatments that can even cause it, like some of the ultrasound treatments. We had a patient, it was temporary. She had a treatment to tighten the muscle, and she ended up with a little bit of laxity in her forehead. Some of the changes to the brow can be from bone loss, which we all know over time bone loss changes, especially in our female patients, and it can be from a variety of things as well, but aging being most common. I think bone loss is something that can certainly cause a brow heaviness, and I'm sure you guys have some other things that you can think of.
Yeah, with the bone, I think it's interesting because people don't realize if they look at a skull from a really old patient versus a young patient. So if we compare like an 80-year-old to a 20-year-old, the actual orbital rims of the eye sockets, they get wider, they get thinner, and so you lose a lot of that support, and so that a lot of that tissue can actually kind of droop or sag down. And so maybe on the YouTube channel, the version of this during this part of the discussion here, we'll put up some photos to show different skulls of different ages. So if you guys want to look at it, go on the YouTube version of our podcast, and you can see differences in skulls of older versus younger age.
And so with treatments like RF microneedling or other, heat treatments, you can dissolve some of that fat, and that fat is helping support those brows. Melting that fat away can definitely, decrease and lower the brow.
I think it's just super interesting as we talk about kind of the anatomy of aging throughout the whole face. We deal with, bone changes, skin changes, fat pad changes. Some go away, some shift and go south. And we're talking specifically about the brows today, but the underlying principle when we're treating the brows or anywhere else in the face is look at some of the underlying causes, and what then treatments do we have that can target those underlying causes, what's appropriate and safe for that patient, and then we can come up with a treatment plan that kind of addresses a lot of different levels.
We've got several things we've talked about that can cause it. We want to talk about some of the things we can do to fix it.
Yeah, that's great. Allie?
So we kind of talked about one of our first causes that we talked about was the use of botulinum toxin for long periods of time. There are some muscles that we can treat in the brow that can also help to elevate. So I always show my patients, and explain, your frontalis, all it's going to do is lift. I can't tell you how many times I have patients that come in and they're like, I want this brow lifted. Can you put some Botox right there? And I'm like, well, that's going to do the opposite of what you're wanting it to do. And so then I kind of go in and try to explain that, but try to explain that, there are muscles in the arch of the brow and the tail of the brow that do kind of pull down, and I'll kind of show them with my eye, and that, see how these muscles pull down. If we can relax those, sometimes it can give a lifted effect. And so sometimes it is as easy as an injection, but a lot of times it's not, and it's more focused on skin tightening.
So how does that work? If we inject a muscle that you said these muscles bring it down, how, if we inject there, is it going to lift the brow?
It's like a pseudo lift is kind of how I explain it, that it's not going to lift or make the muscle higher actually, but by stopping the pulling down movement, it can appear more lifted than it usually does.
Yeah, I think it's kind of interesting because I believe that we see this in other areas of the face and we readily understand it. So we see bunny lines all the time. lies on the side of the nose. And we don't see those a lot in people who haven't had Botox before. Yeah, Jerry's demonstrating it on his right now.
Yeah.
We need to give you some more compensation. So as we treat muscles in one area and we stop the movement, muscles kind of close to that or near that start to animate or work a little bit more. So we can do some things in the forehead to make it lift more. So if we treat certain parts of that muscle and leave parts of it untreated, they will work stronger. So if we don't treat that like lateral part, we can kind of make it work a little stronger by avoiding it up there. Or we can go in and treat those parts that pull down and stop that. And so now we have just the muscle that pulls up with nothing to pull against it. And so it will give you a mild lift. There are ways. That's why it's important to go to an educated provider so they know the difference.
I think it's also educated provider being like a key part of this, because if you don't understand the anatomy and how the muscle works, and so the frontalis drapes over the forehead almost like a curtain, and it's difficult to see my hands if you're listening to this, but the frontalis drapes as a curtain, and it's a lifting muscle. So if we stop the middle part of our forehead from lifting and we don't stop the lateral part, and we still have that lift, then naturally we're going to get some raise in that area. But with that draping motion, if we stop the whole drape, that's when you get like or can get a heaviness. So, and you have to be careful injecting other areas, not to accidentally inject that part of the frontalis that's going to lower it.
I think that was one of my first big takeaways, like following you when I first started in the clinic, was I just automatically thought, before knowing obviously what I do now, was that older patients were going to require heavier dosing because they have more lines and more wrinkles. But really, it's quite the opposite. With advanced age, you want to actually dial it back because you don't want to take away any of that lift, and you have to stay really, really high treating the frontalis on older men and women who want a little bit of that lift, and dosing them much more moderately. That was one of my biggest takeaways when I first started, because I thought the complete opposite.
And it's important to like almost start coaching your older patients into that direction of knowing that they're going to need to have a little bit of movement as they get older. And so that's where we play role as educators to, teach them how to get their skin quality better and different things to give them a more youthful appearance. And we talk about it. Chris and I have talked about this from like the inception of JDCC, long before Skin and Tonic. We started talking about like healthy skin and how much younger you look with healthy skin, regardless of whether you have wrinkles or not. And it's continued to be something I talk about daily.
Yeah, I mean, it's all great points. I believe really getting, putting a nail into what you said, Allie, is understanding anatomy. And I believe that beginning providers oftentimes think we're putting a medication in a wrinkle, and they're not understanding what necessarily that's doing. And so you said, as you followed Jerry around and as we, kind of brought you on board, now you've been there forever. You do the trainings yourself now. But what you quickly learn is not just putting medication in a line or a wrinkle or hollow. It's really understanding the anatomy of that area. And once you understand that anatomy, Jerry did a great job of describing kind of the way that muscle works. And once you understand how it works, where it starts, where it kind of inserts, then you can use these medications to stop it selectively and get these really nice results. But it's not just a memorized pattern that you just go in and put the same in everybody. So so one of the ways that we can create a brow lift, so toxin can cause a heaviness, or we can create some, mild to moderate lifting with it if it's placed selectively. So that's a good option. So what's some other options that we have? You want to take one?
I want to take one. Yeah, so you're the PLEXR expert. So we'll talk about one that we just talked about real briefly off camera, is a thread lift. So that's a brow lift that we haven't talked about much. And a thread uses a PDO suture or other types of suture material. It's a barb, and we go in up near the hairline and literally run the threads down to the brow and snatch it up. That's what people want, is to be snatched.
Snatch
right?
it up.
So that's an immediate result, and it's also collagen stimulating, so hopefully they have some lasting results from it. It's a non-invasive, it's a very quick treatment, it's done in the office. Results certainly depend based on the provider and the type material that's used. As far as downtime, it basically depends on the patient's response. There's always a risk of bruising, bleeding, swelling at the injection site, but typically it's a pretty uncomplicated process.
I think one of the biggest takeaways from any type of thread lift, whether you're doing it for a brow lift or a jawline lift or mid-face, wherever you're putting it, is explaining to the patient up front realistic expectations and making sure they're a good candidate for it. So if we are lifting the jawline or lifting the brow, we can't lift it so much that there's a hunk of skin hanging out at the end of the thread. And so I always try to show them, what a realistic result is prior to even, numbing them, and making sure being like, hey, here's a mirror, look at this. This is about how much we can probably get it pulled without you having a hunk of skin back here or realistic expectations, and then saying, will you be happy with that? Because if not, there's no sense in us going through this.
Yeah, I think that's key with anything, is setting up realistic expectations. And, thread lifts are very effective. So they are this kind of, to me, they look like, the best way patients understand, they look like a fishing line. Almost, it's like a thick fishing line that they've made little cuts into that we can use those little feathers or barbs or hooks to kind of pull and reposition the skin. So they're really, the FDA indication is repositioning of skin. And so we can do that. But these are still, because they dissolve over time, they're temporary treatments. So I think people have to look at them kind of like they would a filler or their neurotoxin. It's something that's going to give them a temporary result for a while. And depending on the type of thread placed, the number of threads placed, underlying condition, all those things will help determine the longevity. So, it could be anywhere from, 8-9 months all the way up to maybe a couple of years. We usually don't really promise that, because there's too many other things that go into this process that factor in. But yeah, I think that thread lifts are nice. And as you said, minimal downtime, quick procedure in the office, really minimal complications. I guess I can talk about PLEXR since you threw that out there.
You're a PLEXR expert.
I do.
Just reading your article earlier this week in a magazine.
Nice. So I do love plasma technology in general. And so in our office, we have a couple of plasma devices. So we have the NeoGen PSR, which is, I'll let you talk some about that because you do a ton of those treatments. And I love that device as well. And we have the PLEXR, which is a different plasma device. Now, the PLEXR's actual FDA indication, it is a plasma device. And when we say plasma, this is not your blood plasma, it's plasma energy. And I always, for patient comparison, we'll tell them the sun is a giant ball of plasma. And so we're taking something of a similar energy source, we're putting it into this handheld device, and we're able to use it for aesthetic treatments. And so it's actually approved for the removal and destruction of excess tissue. And so when we're doing it for something like a lift, a brow lift, or even an upper eyelid lift, and so it's one of the few things we have where we can actually remove tissue in the office without the surgery. So in the aesthetic world, we talk about this a lot as being a soft surgery. So not something you need full-blown anesthesia for. We give you a little bit of numbing, and we give you some laughing gas. And then we use this little device, and we basically use plasma energy to remove selective parts of that extra skin. And so if you have a lot of extra skin in your upper eyelid, really it's that and the NeoGen are the only things that we can do directly on the eye without having to put in all sorts of eye shields and cause a lot more swelling and discomfort. So with this, we just remove that excess tissue in little dots, and then as the skin heals, it will tighten and it will make that brow tighter. We can do that same device above the eyelids, and we do this in what we call a vectoring pattern, where we're going in above the eyebrows, and we're basically putting the little dots that we're removing the tissue in a pattern very similar to what we put with a thread. And so that way, as it heals, it's progressively tightening along that line, and it's pulling up straight in those lines, which is going to give us a little bit of a brow lift. So it's a very, effective treatment option. That are the NeoGen. And the NeoGen we've used actually for a few years longer than the PLEXR. So we've had it now for several years in the practice with great results. And you do a lot of eye treatments with that, Allie.
I do, yeah. It's really minimal downtime, like 5 to 7 days, which is nice. And like you said, you don't have to put these eye shields in, which, to me, I've watched those being put in for like different treatments, and I cannot fathom that. I don't wear contacts. It hurts me to even put eye drops in my eyes. Like, I couldn't imagine doing that. But I've actually had a NeoGen over my eyelids, and I was okay. I think y'all would say okay. I did pretty good with it.
We can call it that.
We should call that. Jerry did it while I sat on top of you and held you down, and Lindsay was across your feet, maybe,
But yeah, it's definitely doable. And the same way how you were talking about the vectors with the, about the brows, you can also do that with the NeoGen, and that heat energy is just tightening that tissue underneath. And so it's really effective, minimal downtime. I feel like the biggest difference is that it's just, tightening with the heat versus there's no ablative. There's nothing ablative about the NeoGen, technically. So there's no tissue removal, but you're still getting tissue tightening, and we've had great results.
Yeah, with the NeoGen, you're actually causing remodeling all the way down to the, reticular dermis. I mean, it's a deep dermis that we're actually working on. And so we're stimulating collagen and elastin. And so these results are continuing to improve over time. So it's not just a one-time thing. That will get better over time versus some of these other things that are kind of wearing off over time. With all of these things, the elephant in the room that we haven't talked about because we don't offer it at our office, but certainly that we discuss with many patients is surgical brow lifts. So I know you watched some videos on this. I've seen it as an anesthesiologist. I've saw many of these, but tell me about what you thought when you watched it.
Yeah, I watched an endoscopic brow lift today online. I didn't go to a OR to watch it, but I don't know, and I haven't seen a non-endoscopic one, to be fair. So like maybe it is a lot more traumatic than the endoscopic one, but it was like it was more invasive than I thought an endoscopic brow lift would be. It was pretty intense. They made 5 different incisions, disconnected the tissue from the skull, and then basically used screws and tied the tissue back up around the screws. I didn't realize there were screws involved. I don't know. I would probably try it if I needed it. I mean, whole girl is knocked out, so
yeah.
I mean, if I'm asleep, you could probably do whatever you wanted to, So.
Yeah, I love it. I'm all about a surgery, so I'm like...
Yeah, you're asleep, so it's not even like, I mean, you don't feel it. So
yeah, I think the recovery from those, like we've had several friends that have had them done. I think the results, just like any of the other things we've talked about, the results are, they vary based on the appropriateness of the patient and the skill of the provider. But the downtime for those things is usually, a week. And so they're, you run the risk of bruising and whatnot, but the long-term results, like
10 years.
Yeah.
I mean, that's kind of worth it. I would like if you're a candidate for it.
If you're a candidate, yeah. And so to me, the thing is, and we've talked about this on other podcasts, I'm sure we'll talk about it on many in the future, but is having those conversations with the patient, because oftentimes they look for surgical options for many reasons. They, one, perceive that it's cheaper. They don't want the downtime, but in reality, they may be cheaper to pay for the surgical brow lift up front and spend a lot of money on all these minimally invasive treatments that still give them a subpar result. And they've spent thousands of dollars to get these results that aren't bad, but they're not the same as surgery. So we always, depending on the assessment, if it's mild to moderate, then we have options. If it's more moderate to severe, then we really refer and recommend patient to go for a surgical evaluation. And then there can be a decision made together whether they want to pursue that or not.
I think that's something that I like to think that we're pretty strong at the clinic, is knowing what we're limited to. And I think patients respect that. And we've had several patients. We have a lot of really good surgeons in our area, and most of the surgeons are good about sending patients back to us when we refer. So that's something I'm absolutely not afraid to do, is refer out.
I mean, I agree with that. And we all three teach a lot, and we repeatedly say that in classes. But I think it's hard for new injectors, or anybody that's kind of new and listening to this. They're always afraid if they lose that patient or they send them to somebody who does similar services, they're not going to get that patient back. And, that may be true. You may lose a few here and there, but the reality is I don't want people stuck with me because I'm the only option, right? I just want it to be their choice to be with me because we give them good results. They get value in what they're paying us for, so they want to come back, not that we're the only one, so they have to do that. So none of us fear that at all. Any other treatments that we've missed? I know one that I want to talk about, but I'll make sure I cover you guys first. Forehead filler.
I'm excited about this because I went to a class at Aesthetic Next in Dallas on forehead filler, and I was like ready to fill some foreheads after I went to that class. Have I done it? No. But because I'm scared actually now. At the time, I was hyped up about it, but I think there are beautiful results with forehead filler. And
yeah, so I've done some, and I think, I've done some of the biostimulants in the forehead, and I really love the results. Actually, I was just commenting, we were just with my mom this past weekend, and I did sculpture in her forehead. And I know it's controversial. People are going to say I'm crazy for it. But I think that you have to be, educated, aware, venture into that with a full informed consent of your patient so they understand that it's off-label, that it's more risky. And then you take the appropriate precautions. And so I don't just tread into that area lightly. It's not something that I take lightly, and I make sure that we do the appropriate precautions. But in selected patients, it is a procedure that I feel can give good results. And, when we look at the underlying causes and we talk about treating those causes, there are very few options that we have to look at things like bone loss, fat pad descent, fat pad loss. And so, we can do things to the skin quality and texture. We can improve the collagen and elastin. We can use threads to reposition the skin. We can use devices to remove excess tissue. But really, if we've had a lot of atrophy of the muscle or fat pad loss, one of the options that we have to kind of make it more optimal to support the brow structure is to look at our biostimulants, so things like our sculpture, our radius, or to look at our HA fillers. And so the HA fillers are the hyaluronic acids, and they do give us the ability to attempt to dissolve that, at least if there's a problem. But when we look at our biostimulants, that also is going to help, some attenuate the process of the bone loss and give a little bit of volume at the same time. So I think those are a nice option to consider. Make sure if you're a patient that you have a really thorough conversation with your provider, that you understand the risks that you're about to undertake if you're going to have forehead filler placed. And if you're a provider, make sure that you get some education on that and that you're fully aware of the anatomy and maybe decide what safety precautions you're going to take. So, if we do that at Skin and Tonic, we're going to do things such as use large cannulas. This is not a small cannula. It's going to be a 22 gauge or larger blunt cannula that we're going to use. We have ultrasound available to look and identify any pertinent vessels. None of these things are 100% safe, but they're things that we can do to keep the patient safer than just blindly doing this.
That's a good one. I'm ready for that.
You ready for forehead filler?
I am.
You're going to let me do it on you?
I will.
All right.
I was excited watching that class. I didn't realize how different male and female foreheads were. And they were showing like putting a male's forehead on like a celebrity female and how different it makes them look.
I don't want a girl forehead.
You don't want a girl forehead?
Not today.
I've done some, not a ton. I want to do more, but I've done some international seminars and classes. And really, it's interesting because outside of the U.S., they fill foreheads almost as much as we do cheeks. So they kind of readily put it. And so we can draw from a lot of their experience into what we do here. The great thing about our system is that by the time they get through the approval process, we have a pretty good idea of their safety record. So when we say something is FDA approved for a particular area, it's been done in a lot of patients, and that the safety data that's reported, the risk of any of those adverse complications are fairly accurate. There are some post-marketing stuff that come up. They're pretty spot on. And so that's good. The bad thing is it takes us a while to get those numbers in. And so to get those new approvals, it's very expensive for the drug companies. It takes lots of patients and years to get those studies. And so in that meantime, you have providers that are using things in what we call an off-label fashion. So they're using it based on their medical expertise and judgment, and they're having those discussions, but it's not studied elaborately. So we draw from experience of others, and in other countries, they do a lot of forehead fillers. So we'll try to find some of those educational things for you, either online or videos or something. So if you're interested in that, you can learn more. Maybe that'll be a goal this year, is to get you familiar with that. That will be everything this week, you guys. Thanks for tuning in for another episode of Beauty in the Brain, and we look forward to seeing you next week. Okay, that's a wrap for this week, guys. Sierra wanted me to be more excited with the outro. Thanks for tuning in for another episode of Beauty in the Brain, and we look forward to seeing you soon. See you soon.
Bye.